Lee C. Chen, two questions. My mom, 89-year-old, suffer from Parkinson, dementia, and has weak heart. Patch X, then Ion and Lavida since October. So improvement lately, left hand trembling and left knee swollen. What can be done? My mom has weak heart and doctor limit her to only 1 liter water a day. Okay, seems like the... Okay, later I mute you, okay? A 30-plus-year-old lady asked, will the life pageant make her body hair grow long again? She was born with very long body hair, even longer than men. She has done all kind of way to remove hair, including laser treatments. I would say, right, my hair didn't grow longer lah. I'm a pak zong guy ah. I'm a no the what do you call the Chinese chicken rice, white chicken ah. No fur one ah. I'm like this one. I got no fur one ah. I got very short fur. I show my leg ah. Okay. Is do you think it's like a girl leg ah? No no fur at all one no. Hey, no fur at all one no. They never go laser no. Do you think it's like a girl leg or not? You think like a lady leg you type 555. You think like a lady leg you type 555. No, really no hair no. Really no hair no. So I'm telling you that for people who have less hair, right, the kidney not so strong and the hair, even the body hair, the kidney not so strong. So I tell you, I don't have a good health from as a basis. So I don't have many hair. So after putting patch, I don't see my hair grow much longer. Okay, but because after I get married, right, then of course we have a sexual relation that increase the hormones. Then you grow a little bit longer because of the male hormones. But I have put the patch before for 3 years already. My hair still didn't grow longer. Okay, so I think the most important thing is this. Even life weight can make your hair grow longer and you don't like it. What if it can fix your menstruation, fix your appetite, fix your skin, fix your pigmentation, fix your wrinkles? Anyway, you are going to cut your hair anyway. Anyone going to do laser every month anyway. But why not we do it while we heal all the other organs first, right? I think this is much more important. Not just focusing about the external health. We have to focus about the internal health. Anyway, if after put the pad, really the hair grows so much longer that she really fed up, she can always stop the patches, right? She always like Ivy, because once Ivy done the surgery, he cannot do anything restore back already. But Ivy put the patch, if she cannot tahan the pain, she can just give up. Tomorrow don't patch already, it's fine, right? So for the 30-plus-year-old, you focus on what can happen to the internal health, not what is the problem that she has concern about. Say, okay, so like this person is Amy, I know that you worry about the hair long. One thing is when you put the patch, if you really think it's affecting you, you can always stop the patch anytime. Anyway, 30-day money back guarantee. But apart from the hair, your menstruation, your appetite, your sleep, what if in this patching is able to heal all the problems? Make you younger, make you look better, make you look smarter, make you have a better luck, make your wrinkles get less, make your pigmentation get less. So if you are a lady, okay, so anyway you are going to go for the laser treatment for the hair once a month. Okay, imagine after put the patch, right, you have to go for the laser treatment once every 3 weeks. That means the frequency increase a little bit from 4 weeks one time, now 3 weeks one time. But you put the patch, although the frequency of hair treatment increase, you spend more money, but your wrinkles reduce. Your no more white hair, no more hair loss, no more pigmentation become less. The scar no more already. You can sleep until tomorrow morning. No need to wake up. Your digestion very good. Your bowel movement very good. Don't need to take probiotic already. Which one will you want? You want the sick body where you laser your hair every 4 weeks, or you want the very healthy body internally and you go and cut the hair every 3 weeks? Which one you want? You want the 4 weeks one, you type 111. You want the healthy body but 3 weeks one, you type 222. You want 111 or 222? You guys want 111 or 222? So Lan Si Chan, I hope you understand what I mean, right? The internal health comes first. Let's not focus about this. So okay, it's the same thing like just now, right? You have to focus on internal thing. If you keep focusing on external things, it's what the doctor want you to focus. Your doctor want, oh, you want knee pain, okay lah, you remove your knee lah. Then the pain still persists. Okay, later I'm going to share with you a case, but I give you the idea first. The case is like this. So the member called me, and I think it's morning or evening or night, I forgot already. And then she was very worried. Hey, Jinlong, doctors want to poke a hole to my mother lung, because the oxygen level very low. Can I poke? I said, don't want to, don't. Said then they, okay, no. Then I said, what should I do? Okay, you now the quick fix is you now she had been patching a lot already. Okay, I say you go to her upper back, go and massage. Go and massage, okay, to make it warmer. To make it warmer, to massage, make it warmer, and massage. If there is any pain point, you put more S39 at the pain point. Okay. And then the next day when I'm a bit more available, then I talk to her again. So how is your mother doing? My mother now is better already, not so grasping for air already. Okay. And then I ask, so what causes this breathlessness? Is it after the X-ray? Why I say like this is because a lot of elderly, right? You are 85, 87 years old. The X-ray is radioactive. It's going to kill the lung cell. And after the X-ray, your lung cell is being killed. Your body cannot inhale the oxygen. Of course, the oxygen get lower. You X-ray already and you measure the oxygen. It's a confirmed way to want you to do the poke the lung. And they say, then they say, before X-ray is, she did a surgery, and when doing the surgery, got the lung infection. And after the lung infection, then the oxygen become low. The doctor want to poke the hole already. You can get the idea. Supposedly want to do I don't know why it's a surgery already. Do a surgery, but the side effect is lung infection. That lung infection called oxygen lower. So now he want to make another wound to the lung to poke the hole, I think 87, 86, 87 years old, Do you think it's scary? I say, oh my God, no. I say, okay, I had to make a choice for you guys since you guys asked me. No, just put the patch, keep on wrapping. So I said, okay, now it's not so breathlessness already. So continue to do, don't stop. Make sure the appetite is good. I said, okay. And then they said, I think it's because of the patch. The appetite very good. It's not affected. Okay, that is good enough. As long as she can eat, the body can heal back the lung. The lung cell can be fully healed. Okay, can heal about 2 weeks time. So you need to make sure these 2 weeks that the body get better. So until about just now, few hours ago, she texted me. Oh, she sent me a recording. Oh, just now, our mother coughed up a lot of phlegm. And now okay already. Now feel better already. See, it's just that phlegm that your body need to get rid of all the dead cell of the X-ray of the lung infection. Once you cough it up, your body have a room to build lung cell. It's okay already. So it's a mechanism. The body is still healing. I don't have cell. You kill all my cell already. So you cause my oxygen to get less. But now you ask a nurse to say my oxygen and less. Now you want to put another hole to my lung. Do you think that this is very, very, very evil? Do you think it's very evil? You damage my lung at the first place, and now with the side effect of your damage, now you want me to do another damage to my body. Do you think it's very evil? If you think so, you die 555. If you think so, die 555. And then want to make her uncomfortable, stay in the hospital, don't want to go out because the oxygen level is still very low. See, the doctor want to keep you longer to look for a reason to do a next surgery. It's scary, guys. This is why. It's because the doctor never think that it's the surgery on the 87 years old cause the body to have this kind of havoc. Your body need time to adjust. But during the adjustment, the kind of fluctuation, you start to want to poke hole you poke throat you poke the kidney you want to cut the intestine What piang, it's crazy. So okay, C Chen so okay, okay, so C Chen can you unmute yourself, C Chen? C Chen, can you unmute yourself, C Chen?
Yeah.
Okay, so I think for the 30-year-old lady, you got my points, right?
I got your point. Let me tell you what she was concerned. She was concerned is that she was born like that, and so I think her problems is related to the hormones, like you say. So she was just wondering is like, will the life patch changed her hormones or not, right?
Amazing.
Exactly the point there is if it doesn't change the hormone, then she was concerned that her hair, the long hair is going to grow back again. That's what
I
she was concerned
see.
with.
I
Right?
see.
Rather than
Okay.
anything else, she was more concerned with that one rather than anything else, right?
I
So that's
understand.
why she was saying, that's why I'm asking that questions like, will the life
Understand.
which change the hormones by born or not? Would it
I
change it
see.
or would it not change it at all?
Right. Okay.
Because I saw all your testimonials about different kinds of things at all. So I
Yeah.
thought it may change it so that she will get better, but I just want to confirm and make sure that's the case because she has other issues. I know that she has like
Fantastic.
the reason she asked is that because she used a lot of laser treatments and all those things, and that caused her to have eczema. And that is why I asked her to. I don't know her actually personally. It's a friends of friends. So
I
by the way,
see. I see.
I'm from Canada right now.
I see. I see. Okay. Okay.
So
I
that's
can
why
hear
it's a
from your
bit
tone.
different. Like our wedding here is a bit different. So she was very concerned that if it grows like that, in what will happen to her if she'll go back the hair, she has to go back to the laser treatments again. So she don't want
Right.
that to happen. So that's why I want to ask those questions to her.
Understand. I understand. Okay.
Yeah.
So maybe I will put it this way. I don't have an answer for her because
Okay.
if that hair growth, right, is come from a hormonal problems, then very likely life can help to fix. And then the,
Okay.
the next question you see, but this is not a hormonal problem, it's a genetic problem that since birth already had these problems already.
Yes.
Then the question is, no one know is it genetic or not. We got a lot of people got a genetic heart problem, a genetic kidney problem. But life is we can see even type 1 diabetes. Previously, there was one member type 1 diabetes. The doctor says it's genetic. We can see the reversal. So it seems to me that a lot of times, right, it may be certain medical procedure, like inject too many medication, too many vaccine, for example, in the very early days, that cause the since birth problems. They mean the body initially in the womb, it don't have this problem. It's after the medical intervention that caused this problem, but the doctors say it's genetic. So I think
Oh,
from that point onward, right, we can try the patch. No need to worry. And
okay.
I think that okay, the worst case can happen to her, right? Even the oh, no, the hair start to grow already. Stop the patch. Then that I
That's
think
not
this
good. That's
is
what I
the
told her. But she don't trust me.
yeah, exactly. So
She
I think
asked
this
me to
is the
ask seniors.
yeah. Yeah, so this is the least, I would say, in terms of risk and reward ratio, right, this is the least risk with the highest reward. Because if this thing is really working well, he can fix all the problem, including the hair also. But if this thing doesn't work as what we said, for example, maybe the hair really go a little bit already, even he has some of the improvement on her health, it still is a profit for her. But if the hair is growing much faster compared to the improvement of her health, worst case, stop the patching, get the money back. I think it's, I think it's a win-win game for her. So just ask her to try. It's okay.
I can't invite her to the Zoom meeting as somebody was saying that mainly because that the time difference is very very big in here. Like we are 13 hours behind, so it's like
Wow.
8 o'clock in the morning right now in Canada,
Wow.
in
Okay. Okay.
Toronto.
Good morning,
Yeah,
Lan.
so I'm
Good
from
morning to
Toronto.
you.
Good
Oh,
morning, thank
Toronto.
you.
Okay.
So I'm from Toronto,
Okay.
but my friend's actually the one that lady, she's from Vancouver. So right now it's like she's 16 hours ahead. So it's only like about like 5 out, 4 out, 4 o'clock or 3 o'clock a day
Right.
in the
Okay.
morning.
You are originated from where?
I'm originated from Malaysia actually.
Oh, I see. Wow, but your slang can pick up so fast. You become a more slang already.
Oh, because I'm been in Canada for more than 30 years.
Oh, okay. I see. No wonder. No wonder. Okay. So,
Sorry.
for you,
Yeah.
yeah. So for your friend case, right? You send the recording tomorrow. When we upload the recording, you can just
Okay.
let her know in which minute. Then you can just ask her to go to the minutes, and then you send to
All
her.
right. Yeah, I will
Okay.
tell her
And
that.
then
Yes.
yeah. So for your mom, 89-year-old, suffering from Parkinson, dementia, and weak heart, patch S and eon and Alavida since October. What are the improvement that your mom has seen in terms of
Oh,
Parkinson,
a lot,
dementia, and weak heart? A
a
lot.
lot.
Okay. Tell us.
Okay. She actually at the beginning there's no conversations that I can go through with her, like the normal conversation. She cannot understand me, but after patching, she can understand me. She can reply to me. She can talk very well, and then she also can walk much better because my mom has a lot of problems with walking, right? She has to, like, we don't let her walk by herself, like the maid have to help her. My mom is in Malaysia actually.
I see.
So,
Wow.
yeah. My mom is in Malaysia. But I'm
Okay,
in
I want to
Canada.
ask you,
Yeah.
yeah, I want to ask you, Alana. So, do you feel it's very relief that although you are not by your mother's side, at least you can send a patch to help your mother and see
Oh
improvement?
yeah. Oh, that's a big help. That is really, really a
Oh
big
my
help. I can
goodness.
tell you that this patch is so good. Yes, I have to say that. For myself, it's also bad.
Amazing.
But for my mom, especially, I can see the
Okay.
big improvement in her. Not only that, I have another friend
Wow.
that she just joined recently, and her mom is also suffering from
Yeah.
dementia. And within a month, her mom is improved a lot. Like initially, my friend's mom, she cannot even remember her own son's names, and now she can
Wow.
remember her own son's names, and then she can talk much better. I mean, on and off, right? Because it's just a month now. So same thing for my mom. She's like just a month, right? I mean, not a month. She is like few months. But because of my mom's heart conditions, we we are afraid to
Yeah.
patch her for 12 hours. I only patch her for like
Right.
increasing from like
Right.
2 hours, and then now it's 8 hours. So I just wondering, like,
Right.
because her hands start trembling. She has Parkinson, so her hands start
Right.
trembling again,
Right.
and
Right.
her knee
Right.
also swelling. So, but she has very good
Right.
appetite. She go to washrooms very well right now. Like she used to have the
Okay.
constipations, but now she go to
Right.
washrooms very well. So that's really a
Wow.
great
So wow.
improvement.
So many
She has a
changes.
lot of improvement. We are very,
Fantastic.
very happy with that. Yeah,
Amazing.
she can walk very
Amazing.
well,
Amazing.
and but sometimes she didn't sleep well. That's why we put Alavida
Right.
instead. Yeah, but we didn't put it together because if it is together because of the very hot conditions there, and she keep asking for water, and I'm hesitant to do that because uh she has a very weak heart, right? Every time we
Right.
increase the water, she end up in hospital. So that's why I'm
I
not quite sure.
see.
It's like, will the patch make that go away or not? I'm not quite sure. Like we still very hesitate about that one because it's not it's she's not my only mom, right? So I have my brother and sister,
Right.
and we all like opposites to giving her the patch.
Understand.
So I insist on giving her the patch.
Understand.
Now they see the good result. They're happy, so they start thinking, oh, maybe I can still use it too. That's the reason. But anyway, yeah, I know, but that's the only problem there. But my question
Right.
is still the same. It's like, what should I do to improve her hand trembling? Should I
I see.
increase to let her use the consonants or something else?
I see.
I don't know.
I
That's why I
think
want to
now,
ask.
yeah. So now you use minimum for 3 months already. If you want to add with X49 is also okay.
X49 for my mom.
Yeah, for your mom is okay.
Okay.
Below the
So
belly
as
button. So
okay.
yeah. So and then for okay, they mean only recently the left hand start to tremble, is it?
Yes, the trembling.
Or
That's a weak hand.
all
That's a
the
weak
while
hand.
has
She
been
used,
trembling.
yeah,
Hello? Yeah.
she used to, okay, she used to have problems, like she fell down and broke her left arm before. That's why that is trembling. That's why I was thinking that, like you said, that's the healing process.
Yeah. Yeah, you are right. So because normally, right, if left hand, left knee at the same time have a problems, the trembling and knee pain come together, right? Normally is that side have a big fall before.
Okay.
You get the idea?
Yeah,
Let's say
that's
you
the
fall
weak
down,
side.
maybe
We know that.
yeah. So
Yeah.
I think now it's healing for that side. So I think it should be okay. So why I ask you because some people that all the while even their Parkinson they don't have trembling problem, and then after putting the
Mm-hmm.
patch, normally not so likely then you will see the trembling, especially you see the connective improvement already. So that trembling,
Mm-hmm.
it shouldn't become from the Parkinson, it should be other way. So if you say, oh, last time don't have trembling, that means it's more likely come from a healing from a past for because left hand and left knee almost the same time.
Mm-hmm. Mm-hmm.
Yeah.
Okay.
So
Do
I
you
think it
think
should be
that
fine. I think it should be fine.
I can patch the X49 on her below her belly to improve that?
Yeah, you can patch the below the belly for X49 definitely can. It's just that if now everything is good, doing well, right? Even you put with exiting what you have, right? It's okay. It's okay because after you put X49, right? Some of the old injury might be resurfaced back again. So normally I will tell people to add X49 after about after 6 months of X39 Eon. 6 months later they add X49 for people who have cognitive problems like Parkinson, dementia. After 6 months you don't see result, then we will say add X49. But your mom has been seeing terrific result already, right? Even without X49, keeping what you're having right now is good enough already. So all these things, right? Maybe it will subside maybe in just 1 or 2 weeks time.
Okay, maybe I'll
Yeah,
let her subside like that, because the reason
yeah,
is
let's
that I'm
subside.
just hesitate because the more patch I put on her, she's getting more thirsty and she asking for more
Yeah,
water, and I
yeah,
feel
yeah,
so
yeah,
bad
yeah.
that
That's one thing.
she's not drink that
You
much
are right.
water.
You are right. You are
Yeah,
right. You are right. Yeah. So, and
yeah.
just now you mentioned about will this heart problem goes away? Oh, you had to look at the Zoom 2 weeks before. We have someone
Okay.
really got an enlarged heart, and that one now go back to original size already. So it's
Wow.
definitely for sure is able to help you to remove that water around your heart, and then your heart can become stronger, can pump better. The reason why now we have a weak heart, the doctor will do the ECG and things like that to say that the heart is very weak, the beat is very weak. The reason the heart beating so slow and weak is because there was a layer of fluid that's covering, this slowing down the heartbeat. So we
Um.
will help you to remove the fluid from the heart.
Okay. Perfect.
Yeah. Okay. So
Good.
what you're going to find is this, right? You will see the water retention of your mom subsiding. Like for example, last time she has maybe swollen face, swollen hands, but now you can see the joints. You can start to see the bone at the joints already. That is one of the signs that the kidney get better and the heart get better.
Okay.
Yeah.
Yeah, I did
Okay.
see her hands actually improving, because her fingers is really getting better. Like she can move it better, because she used, especially her
Amazing.
left half hand, the
Yeah.
fingers used to be really cramped together, but now they open up and then she can do better.
Ah.
Yeah, because I
Wow.
have to do trying to do the exercise with her every night, and then
Right.
her fingers move much better.
Oh, so you're saying that the hands isn't swollen before, it's just that the hand clenched together.
They cramp together, yes, pinch
And
together.
okay, do you
Yeah.
find that your mother, in terms of the look, also look better in
Oh,
terms
they
of the joint, much better?
much
You can
better, much
my
better. Yeah.
slimmer. You see your mom, the face slimmer.
No, my mom used to be very thin actually, and now
Okay.
she's fatter. And everybody, like during the Chinese New Year, when everybody visited her, they were so
Yeah.
surprised that my mom looked so well. Like
Wow.
all the
Amazing.
relatives come here and they say, "Wow, your mom doesn't look like she has dementia or Parkinson's. Like she looks so well. Really,
Oh,
my mom looking
amazing.
so well."
Amazing.
Yeah, this is that's
That's
one that
good
we
news.
all very very happy with that.
Amazing. Amazing. Okay.
Yeah,
Very good. So
I
don't
guess we
worry.
just
Once you
want for more, like just to make sure that she's good.
Yeah, she's good. She's good. Don't worry. And
Thank you
do you
so
come
much.
back for Chinese New Year? Do you come back for
I
Chinese
didn't
New
come
Year?
back for Chinese New Year. No, 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 no. I planned. I don't know. I plan next time, because I'm suffering from the crisis myself.
Okay.
I
Don't
have my
worry.
own
You
problem.
keep your problem. Okay. You ask about your question and improvement next round. Okay.
Yeah, I know. That's what I'm saying. I don't want to disturb everybody's times. I just come next time. But it's just because that is,
Okay. Thank
for
you.
us,
Thank you.
it's very, very early in the morning. I have to make the clocks, the alarms to sound before I come
I
in.
see.
That's okay. Thank you so
Sure.
much anyway.
Sure. Sure.
Yeah.
Thank you.
Thank
Thank you. Good morning to you. Okay. And have a nice day. Thank you. Take care. Amazing. Hey, guys, Ivy 夸 Ivy，你60多岁，你放弃1个月，人家89岁又 Parkinson，sorry, I should speak English. Sorry, Ivy, you use for 1 month, you say you painful want to give up. People 89 years old, no, dementia, Parkinson, heart core problems, no, wear for 5 6 months, oh, people never give up 89 years old, no. Now can start to talk already, can walk already, from people cannot walk now can walk, oh. Cannot remember the name now can remember the name. For cannot even have a conversation now can have a conversation. No, the look makes so much better. Last time cannot open out the feet now. The fist now can open out the fist. So 89 years old after about 6 months got this kind of improvements. Do you think it's magic? You think it's magic? You die 555. Last week Joelle also shared her mother cannot converse dementia. 2 months later can catch things, can gardening, can talk to the sun, can say thank you to the sun. Now we got this case, 89 years old, Parkinson, dementia. See this kind of improvement. All her was overseas. I think this is magic things for us as a children. Like, if you want to read, even you want to bring your mother to the doctors, right? You need to come back to Malaysia, spend time with her, look for new doctors, and hopefully you find the right doctors. And most of the time you don't find the right doctors, and then you leave your mom. You go back to Canada, your mom live with all the side effects. I think this is the last thing that a Lan don't want to see. The last thing the Lan want to see. I come here to spend the time 1 month with you, go to the doctors, do for the surgery, go to MRI, go to X-ray, spend all the money, and then when I go back, I receive a call, oh yeah, my mom, the pain get even worse. I think this is so disheartening, right? But now, Lan is staying in Canada, make a call, the patches come to her place, put the patch, a few months later, can talk, become happier, can walk. Even people look at her 89 years old, look so much younger. It's magic or not? Guys, I'm saying, I want you to know about the value that life is giving to you. It's not just about, I want life to help my pain. This pain, this all I want to need. For me, you are a bit too arrogant already. You're too arrogant already. And for me, right, if you are arrogant, right, somehow I think the universe is going to give you a lot of lessons before you start to erode your arrogance and then start to trust the process again. Okay? I have seen so much of case like this. It's not because the patches doesn't work. It's not because no doctor is not working. It's not because nothing is helpful. It's because you simply are too arrogant for everything to be helpful. Do you understand what I'm saying? Do you have people like this? It's not about the thing that around him or her is not helpful. It's just that his or her arrogance is make the thing around him or her very difficult to be helpful. Do you understand what I mean? If you agree what I'm saying, you type 555. Is the arrogance make the thing around you not helpful? It's not the thing around you is not helpful. Everything can be helpful, can be well. It's just that the kind of arrogance of you want the way you want the thing exactly that you want it. That kind of arrogance, even you plant flowers, right? You cannot expect the flower can blow one time, right? Even the sunrise, you cannot chop tomorrow 5 a.m. the sunrise can come, right? Even you plant a seed, you cannot make sure I give you the seed, I give you the water, I give you the fertilizer, tomorrow you should grow, right? You also cannot, right? And this is how the universe works. But you are going against the law of nature. You want the thing happen exactly to your own way. You're going to suffer. You're going to suffer.